Sammy McKnight is our president of the UAA Prepharmacy Club, who is hosting our guest tonight, Dr. Adams. And so, Sammy, thank you so much for joining up with us and letting us invite Dr. Adams to speak. And if you'd like to introduce her.
Yes, thanks for coming, Dr. Adams. As you can see, you are Associate Dean for Academic Affairs and Clinical Associate Professor. So yeah, take it over. Thank you.
Sure. So I am the Associate Dean for Academic Affairs at the College of Pharmacy. I've been at Idaho State for the last 4 years. This is my 5th academic year that we just started. So I am an Idaho native. I went to Boise State for undergrad. I went to ISU for pharmacy school. So I like to say, for those of you that are familiar with Idaho, there's enough love to go around for the Idaho universities, as long as you don't ask me to love a University of Idaho vandal. So, but yeah, so I did go to Idaho State, and then I moved away after that. So when I was getting ready to start pharmacy school, I had worked as a pharmacy technician in an inpatient pharmacy for a couple of years before I went to pharmacy school. And so when I started pharmacy school, I had this clear path in terms of my career of what I wanted to do. I was going to be an ICU pharmacist. I was going to work in a shock trauma unit. Hopefully, back in Boise, Idaho, living close to my parents, right? So I had this whole plan when I started pharmacy school. And as I went through school, that really stayed fairly consistent. I was exposed to a whole bunch of other career possibilities and career opportunities, but that still stayed fairly consistent. But while I was in pharmacy school, I was involved as a student leader, and I was involved with it's called something different now, but it's essentially the American Pharmacists Association with their student chapter at Idaho State University. One of the upperclassmen asked me if I was interested in being a leader in the chapter and working on some of our patient care projects. And I was like, yeah, I think that would be really cool, because, this person had no idea, but she came to me and she was like, I think you'd be a really good leader. And I hadn't really had anybody tell me anything quite like that before. So I was pretty excited that she saw something in me that I didn't know was there. So I started as a student leader with the Operation Immunization group. So I don't know if any of you guys have heard about some of the activities. Here, I'm going to pick up the dog. Oh, just kidding. Now she's going to run away. So she's just going to whine now. So the students at ISU and at colleges across the country participate in these different patient care projects. And so the goal is that students will provide services often for free or very low cost to people in the community. So it's things like immunizations, diabetes screenings, heart screenings, heart disease screenings, all sorts of different things. Those are just a couple of examples. And so that's how I started out getting involved as a student leader, and then had the opportunity to be a student leader at the regional level and at the national level as well when I was in pharmacy school. So lots of exposure to lots of different things. And I get to my 4th year of pharmacy school and I'm still thinking critical care. Right? Like, I still have this passion and I still want to pursue this path. I scheduled an elective rotation in critical care. I scheduled my pediatric rotation so that it was half NICU, half PICU. So still very focused there. But I tell people all the time, I was in the right place at the right time and said the right thing to the right person for the opportunities that happened at the beginning of my career to come to be. I went to a conference on alcoholism and other drug dependencies at the University of Utah. Went out to dinner with a group of people. One of the guys was a pharmacist. He asked me what I wanted to do when I graduated. And I told him, I said, because here I'd worked with this guy at the national level, because he worked with all the student leaders nationally. I looked at him and I said, I was really passionate about critical care, but I also think it would be super cool to have your job. And he looked at me and he was like, okay. And it was really awkward because I didn't know what to say. Like, did he mean okay, like, okay, cool? Or did he mean okay, like, all right, you can be next in my role? Like, what? It was really weird. And then he called me a couple weeks later and he was like, so were you serious when you were saying that you were interested in a job like mine? I said, absolutely. I would love to explore, what the possibilities might be in association management. And so from that point on, I had a ton of opportunities during my 4th year of pharmacy school. I was, they called me the never ending intern at the American Pharmacists Association. So I did some things at some educational meetings for students in the fall. I went to Washington, D.C. in January, and I helped with one of the student leadership meetings, like as if I was a staff person. Then I went to their annual meeting, which is like 11,000 pharmacists from across the country. And I got to help with some of the student programming there. I also think of it as like a never ending interview as well. But it was a great experience and a great opportunity. And ultimately they created a new position working with students at the pharmacy schools across the country. And so it was pretty exciting that here I was, I think I was even the only person they interviewed for the job because I'd been like this never ending interview. And so at that point, when they offered me the position, I had to decide, do I want to do a residency and a specialty in critical care, or do I want to go this other route? And it was a really, really tough decision because I'd had this plan, right? Also, my classmates were like, what is this? Like, is that even like a pharmacist job? What does that mean? And so I really had to do a lot of introspection, a lot of soul searching. And the thing that tipped the scales for me was I thought about all of my classmates. Most of them were awesome, going to be amazing pharmacists, but there were a couple that I was like, I'm not certain that they get it or that they're here always for the right reasons. And I'll tell you a story about one of the guys that kind of fit into that category. When we started pharmacy school, he was like, I just want this job because I want to be able to work 3 days a week and I want to be able to play the other 4 days of the week. He had this clear plan about what he was going to do as a pharmacist. And he just never really seemed to be super passionate about the profession of pharmacy. Well, one of the events that I was planning for Operation Immunization, I really needed some manpower help. And I bribed him with a 6-pack of beer to participate in this event. And he came and he had the best experience. I mean, he gave his first vaccination outside of the classroom. He'd never given one to a real patient before. And at this event, he had the opportunity to give one to a real patient. She was the cutest little old lady. And he very well may have hit the bone with the needle, but good news, he didn't react. He just, and then afterwards, she looked up at him and he was this big, big guy. She looked up at him and she was like, man, that was the best one I've ever had. I didn't even feel it. And it was that experience for him that he caught this vision of what it could be to be a pharmacist. And it was the coolest thing to get to watch him have that experience and to feel like as a student leader, I'd been a part of that, part of his educational process. So funny story, he went on and did a residency after pharmacy school, went on and now has been a residency director and has been training students for years and years since then. So his career path changed because of this opportunity. So I started thinking about that and I started thinking, if I work for a National Pharmacy Association, I can be a part of those kind of stories, but not just one-on-one. I can be a part of those stories at every pharmacy school if I can inspire student leaders to participate, to do these things, to really embrace the profession of pharmacy, think of what I can do for my profession if I take this kind of a role. And so it really came down to being the decision of, do I want to have this sort of exponential impact on my profession, or do I want to have kind of one-on-one, unconscious and sedated impacts with patients in the ICU? And so it really was weighing that, like, do I want to have this one-on-one impact, which is still super important, or do I want to explore this other path? And I took a leap of faith, and thankfully it all worked out. And I moved to Washington, D.C. from Idaho after I graduated from pharmacy school. And I came to learn that I was one of only a handful of pharmacists who'd ever done that without doing like an association management fellowship or residency, because those do exist for people who are interested in that kind of a career path. Looking back, the extra training might have been nice, but I just jumped in with both feet, and I spent 4 years working at the American Pharmacists Association. I worked with student leaders from all across the country. I oversaw all of the patient care projects that they provide the framework, and then students at the colleges of pharmacy implement those programs. So I had that opportunity. I got to run the National Patient Counseling Competition, and I was also in charge of all of the educational programming for student pharmacists at the fall meetings and then at the spring annual meeting as well. So I got to have a really varied experience. I've been to almost every single pharmacy school in the country, which is kind of cool, because they sent the staff and some of the student leaders on student outreach visits to the different colleges. And so I got to have some really, really cool experiences. I got that opportunity to build a really great network as well. And that network actually led me to my next job, which was at the American Association of Colleges of Pharmacy. So here I'd been working with colleges and student leaders for about 4 years. And then I made the transition over to working with deans at all the colleges. So working at AACP, I still worked in the area of student affairs, but I supported like the associate deans for student affairs. I ran, and don't throw tomatoes at me, it's not me anymore, but I ran PCAT, I ran PharmCast, and I had some again, really great experiences, great opportunities. My network just continued to grow. And I loved working with, people in academia. And while I was at AACP, my boss looked at me and he said, "So what's after this? What's next?" I think I'd worked there like a year. I was like, I'm pretty good here. I'm not looking to leave anytime soon. And he's like, "No, like big picture, 5 years, 10 years from now." And I was like, I've supported pharmacy schools almost all of my career. And I kind of think it would be cool to work at one. That same idea of the exponential impact that you could have on your profession, you can have as a teacher at a pharmacy school. Because if you help that, one student get that spark, all the patients that they impact in the future, you can play a role in making sure that that's a positive experience for patients moving forward. And so I kind of shared some of that with him, and I was like, I think I might want to be a leader at a college of pharmacy. And he said, "Well, keep working here, keep doing what you're doing, but you also might want to consider some additional education." And I was like, "Nah, I'm good. I don't want to go back to school. I've got a bachelor's degree. I've got a PharmD degree. I don't need to do anything more." And then he kept kind of needling me a little bit about it. And so he said, "You know what, just apply for one of these programs in education. And if you get accepted, then we can talk about it. And then you can decide." I think he knew that if I got accepted, there was no way I was going to not go. So I applied for a doctorate in education focused on higher education administration at George Washington University. And while I worked at AACP, while I was running PCAT and PharmCast and all of those other things, I got a doctorate in education as well. This is before being married with children. So that changes things, right? But it was a great experience and one of the best opportunities that I had in terms of furthering myself and developing myself, which was pretty awesome. So that's the big long story of the whole history of my career. But since I spent about 15 years in working in association management, I thought it might be nice for me to share a little bit about my career path. And I would love to answer any questions that you guys have about careers in association management. In case you didn't know, there's 17 national pharmacy associations that represent pharmacists in pretty much any practice setting that you can imagine. There's only a handful of pharmacists that work at those national associations, but there definitely are some. I've also had a lot of experience too, working with pharmacists that work in the regulatory space. So the executive director of the Idaho Board of Pharmacy is a pharmacist. It actually used to be my husband up until a few years ago in Idaho. So I have lots of experience and can answer questions about regulatory careers. And then so I teach pharmacy law and I've become a bit of an expert when it comes to healthcare policy in the time that I've been at ISU. And so I work a lot with folks like, did you know that Walgreens employs pharmacists to go to board the pharmacy meetings? Like they just learn about what's happening with the laws in all 50 states to make sure that Walgreens is always compliant with all the laws where they have their stores. So there's jobs like that out there that I think sometimes people don't think about. So I can talk about regulatory jobs. I can talk about association management. I can talk about academic leadership. So I'm open for any questions that you guys have.
Wow. So Dr. Adams, every time I hear or even think about your career, I'm always blown away. And it's also very moving to hear, just wanting to create that spark. I feel that in my soul. So thank you so much. And so yes, any questions that anybody has, please do pipe up. She is a wealth of information. And we're very lucky to have her.
Thank you. I'm happy to be a part of the team at ISU. I'm grateful that I was able to have that really cool national experience and build this massive national network because I feel like it's sometimes such a great benefit for ISU. So did you guys know that pharmacists did stuff like what I just talked about? A couple people I see, Abby's nodding.
I had a question. So you said someone told you that, like, what are you going to do beyond pharmacy association management? Is there a particular reason why they said that, or like, is it not a long-term thing?
No, I think so. My boss at the time was a former dean from a pharmacy school. So I think he was looking at it more as like like a mentoring opportunity. In general, I mean, there are people who stay in a job their whole career and never leave that organization, but it's becoming more and more rare. People definitely, kind of move around and they do other things. There's a period of time where you're like, okay, I've learned and grown all I can in this role, and I want to explore other things. And for some people, that's, I want to provide patient care in this particular setting, and I want to do it just this way, and I want to do it just like this for the rest of my life, and that's cool for them. I think he kind of understood that I'm the kind of person that needs a lot of variation. So he was more just trying to get me to think about like, okay, what do you want to be when you grow up? Even though I was technically a grown up, but compared to him, he had a good 30 years on me. So I think it was more of a kind of a mentoring type conversation. So, but yeah, you can work in association management for your whole career. I've had actually a lot of people asking me lately. So The CEO for my last job announced her retirement. And so they're doing a search. And I've had a lot of people email me or call me or text me and say, "Are you going to apply?" And I say, "No, I'm good. I'm happy where I am."
Don't go, Dr. Adams.
Oh, I won't. I promise.
I know, it's like break out the rope.
I won't. I promise I'm not going anywhere. But it is nice to know that people think of me that way, right? Like based on the experience. So, but yeah, my last boss was in her job for 20 years as the CEO. And before that, she'd been a leader at the American Pharmacists Association. Before that, she worked at a pharmacy school. So
It's a small world.
super small. You guys will learn that pharmacy is a really small world and everybody kind of knows everybody.
I had a question actually.
Mhm.
What were like your key roles in association management?
So my first role was really focused on students. So I was like, my official title was Director of Student Affairs at the American Pharmacists Association. So they have different staff that work in different areas. Like they've got pharmacists that oversee all the education for pharmacists. So pharmacists are required to have continuing education every year. You got to keep up your skills to keep your license. And so the American Pharmacists Association offers a ton of different live, online, live synchronous types of educational programming. So there were pharmacists that worked in that space. And then there were pharmacists like me that worked in more of what they called like the professional affairs area. And so there were some that worked on like big picture initiatives to advance the pharmacy profession. There were some who worked in government affairs. In fact, the vice president of government affairs that followed anything federal as it related to pharmacists, she went on to become the chief of staff at the FDA after having that role at the American Pharmacists Association. And the chief of staff at the FDA is a political appointment. So it depends on the politics of the president for someone to stay in that role. And when those politics changed, she went to a consulting firm. Now she's a CEO of a foundation, a pharmacy related foundation. So another kind of example of sort of a different career path. But in my role in student affairs, I oversaw the National Patient Counseling Competition. I oversaw all of the patient care projects for students. So those patient care projects, the association would provide the framework. So I would write, and some of our students, I don't know, Liv has seen like the binders. They're no longer binders, everything's online now. But when I was working there, they were binders that provided the framework that a student would need. So you read through all the instructions and then you can implement these activities in your community. So whether it's a flu vaccine clinic or a diabetes screening, I was writing the resources for the students. I also oversaw educational programming for students. So think of this as like co-curricular stuff that you would do to develop yourself, like professional development when you're a student. So I oversaw all the educational programming, had to invite speakers, plan sessions. Sometimes I was doing things like planning menus for these conferences. So sometimes using skills that had nothing to do with me being a pharmacist, for sure. I did get to help plan some of the fun social events too. So that was nice. But so all that educational programming. And then I think what was probably my favorite part of my job was I got to work with the student leaders. So I got to train student leaders on how to be better leaders. I got to work with the chapter presidents from all of the colleges across the country. I got to work with the regionally elected leaders and then the nationally elected leaders as well. And I have a picture, it's in my office here at home, of the first group of national student leaders. They framed a letter and a picture of themselves to give to me at the end of the year. And I still think back to how much they influenced me. But I also know that I had the opportunity to influence them and help them do amazing things in their career. When I think about that group, one of them is the director of hospital pharmacy at Methodist Hospital in Houston, Texas, which is one of the largest health systems in the United States. And he's the head guy for everything pharmacy. One is a faculty member who her appointment is, she has a master's in public health now, and her appointment for her faculty role is partly at the New York Health Department and partly at the university. And she also does a huge amount of work related to equity and diversity and improving access for patients to care, improving the profession of pharmacy. She's been an amazing leader at helping pharmacists recognize their role in diversity, equity, and inclusion. Some folks that have gone on, one of them went on to law school, and he's now the general counsel for a regional chain called Meyer Pharmacy. It's a grocery store in the Midwest, like Michigan, Ohio, that area. So they've all gone on to do amazing things. And I like to say, you know, I take credit for all of their success because I was one of their teachers. No, I'm just kidding. But I think that was one of my favorite parts of my job, because I had the opportunity to influence those student leaders, help them to develop as, you know, figuring out who you are as a leader sometimes is really hard. There's lots of different leadership styles, and figuring out which one fits for you. I also had to make sure, you know, they traveled all over the country representing our association. So I had to be sure they were going to do it and do it well, and that they didn't have any time that they felt like they weren't prepared. So we did hours and hours and hours working on their presentation skills, making sure that they were set and ready. We worked on their skills of, you know, when you sit down and you have a meeting with a dean from a pharmacy school and you ask them what the American Pharmacists Association can do for them, they usually have a really long list. So we had to make sure the students were really prepared for those conversations. So lots of leadership development, lots of educational programming in that first job. And then in my second job, it was different, because I was no longer working with student leaders. I was working with academic pharmacy leaders. So people with dean in their title were my sort of main customers. And my job was to figure out solutions that make their lives easier. So when I first started, PharmCast had just launched. It was brand new for pharmacy schools. And my first job was to convince all the pharmacy schools that this was a good resource for them. We had kind of that first contingency of schools that wanted the service and wanted to participate. And then I had to work really hard in helping other schools see how that could potentially be a solution for them. And partly because we knew it would be a lot easier for the students if they could all apply in the same place, right? It's a lot easier to fill out one application and choose the schools you want to apply to than it is to fill out 18 separate applications, right? So not that anyone's applying to 18 programs. Usually it's in the 5 to 10 ballpark, but yeah. So working with the vendor that ran PharmCast, making sure that the user experience for students was a positive one. Tracking the national applicant pool and giving all sorts of information back to the pharmacy schools about, you know, what does the accepted applicant look like? I did a ton of work there with pre-health advisors as well. So I worked with the pre-health advisors from, over 3,000 universities across the country. And making sure that they had good information about what it means to be a pharmacist, that they had good information to help students navigate the PharmCast application. I also talked a lot about PCAT and how to prepare for the PCAT, and what to do if you don't pass. How do you go back and fix it if you not that there's like a pass, but if you don't do well the first time, what do you do before you go back and take it again? So I spent some time talking with pre-pharmacy students, but most of the time I spent with advisors and deans. And it was a really fun job, and I learned a lot. I learned a lot about how there can be big picture things like PharmCast that can really change the profession. In that job, I also got to oversee a program called the Walmart Scholars Program, which helps to develop future faculty at colleges of pharmacy across the country. Kind of a cool story on that one. The guy that worked at Walmart who saw the vision of, okay, we should do this. If we don't have good faculty at the colleges, we're not going to have good pharmacists to hire for our stores, right? So I think that's kind of visionary. I mean, there's a lot of things to not like about Walmart, but that's a pretty cool thing about Walmart to like, right? And so I just thought it was amazing they'd have that kind of vision. And so we were able to grow that program. So there's now 85 students per year that get to participate in that program. And it's a great mentorship program. It really helps to develop people into academic careers. And so I ran that from the association management side, from here's the rubric for how we evaluate all the people who apply, to posting all the information on the website, to gathering all the application information, to gathering reviewers to score the applications, to looking at the final list of all the scores and making sure there weren't 15 people from one university and nobody from 10 others. And so managing all of that and sending out those awards, that was a really, really cool project to get to work on. And I got to do that for about 10 years, 10 cycles of that program. And then super exciting last summer, actually, it was a little bit before last summer, I had a student at ISU who approached me and asked me if I would be willing to serve as his mentor because he wanted to apply for the Walmart Scholars Program. And he was selected. And so I got to serve as a mentor last year, which was really kind of come full circle. So kind of cool. Does that help give kind of an idea? No typical day, no typical week. Both jobs involved a lot of travel. A lot of attendance at national pharmacy conferences. I think I've been to almost every single national pharmacy conference that there is. Hospital pharmacists, community pharmacists, consultant pharmacists, managed care pharmacists. I've been to them all. So that's one of the things in your job. They usually send you places so that you can meet with people that will be at those conferences. So yeah, does that help give a better picture?
Oh, definitely. Thank you.
Sure.
So Dr. Adams, I actually have a question.
Okay.
You've mentioned pharmacy initiatives, and in your opinion, what do you think is the most exciting pharmacy initiative that is in the works right now?
So one of the ones that I think is the most exciting is when I was in pharmacy school, we learned a lot of things that the faculty would say, you're going to learn about some of this stuff, but the odds of you really seeing this happen in your career and seeing a pharmacist provide this kind of service and get paid for it, just like a physician or a PA or a nurse practitioner would, that's probably not going to happen in your lifetime, right? So, I graduated from pharmacy school thinking, okay. And then not long after that, Congress passed the Medicare Part D drug benefit as part of Medicare. Because a big part of the reason pharmacists were never paid for anything was because there was no drug benefit prior to 2006. So it sounds crazy, but Medicare patients had no insurance that paid for their drugs before then. So that was a great opportunity for us to figure out how we can get pharmacists paid. We might not have done it the best at that point. And so there has been this initiative for probably the last 5 or 6 years around having pharmacists recognized as providers, similarly to a nurse practitioner, a PA, or a physician, so that you can bill the insurance for the service that you provide and not have to bill based on dispensing a product to a patient. So part of the reason pharmacists aren't recognized as providers in Medicare right now is because we're not on the list. There's actually a list of these are the people that will pay, and pharmacists are not on the list. So we've been trying for a number of years to get pharmacists added to that list. Everything that's been happening with COVID, it leads me to believe that there's a potential that at the national level we'll hopefully get there sooner rather than later. So I don't know if you guys know, but with COVID, there's been an act called the PrEP Act that was, it's an executive order that was put into place by the Secretary of Health and Human Services. And as part of the PrEP Act, this is like, I'm going to nerd out on pharmacy law for a second. This is like super historical, has never happened in the history of the United States. Okay. So there's powers that the federal government has, and then there's powers that the states have. And the states have always had the power to regulate health professions. That's not happened at the federal level, which is why when you're a pharmacist, you have to get a license in the state that you practice in, right? Because you're regulated based on that state regulating you. So as part of the PrEP Act, they have given practice-based authority to pharmacists, pharmacy technicians, and pharmacy interns at the national level, which has never happened in the history of the United States. They've allowed pharmacists, and the reason for this is because the laws vary state by state. Pharmacists in Idaho can literally do almost anything that you're trained for. We have the most progressive pharmacy practice in the US. Alaska is not very far behind Idaho, pretty darn close, okay? So pharmacists in Idaho and Alaska can do really cool things. If you lived in New York State, pharmacists can barely give flu shots and only to people over the age of 18. You want to give a shingles vaccine? Nope, only flu shots. So the PrEP Act has said that a pharmacist can delegate to a pharmacy technician to administer a vaccine. A pharmacist can independently prescribe therapy for COVID. This is huge. This just came out a few weeks ago. So this stuff that's happening at the federal level, I hope is going to be something that really helps us get to a positive place where pharmacists can be paid for their services just like anyone else is. But one of the other aspects of that initiative that's been kind of a grassroots effort is that pharmacists in each state have been working to make sure that state Medicaid programs recognize pharmacists as providers. And so over the last couple of years, our faculty at ISU have worked really hard. And I was one of the key players sitting at lunch, saying the right thing to the right person at the right time, got pharmacists added to the list of providers in Idaho. Alaska didn't even need to add them to the list of providers for Alaska Medicaid. They just had to be added to the form to become a provider. So Dr. Wadsworth in Alaska and some of the faculty up there worked with Alaska Medicaid to make sure that pharmacists could be added to the form. So I think this grassroots groundswell with Medicaid will hopefully at some point influence Medicare. And why do we care about Medicare and Medicaid? They're the largest payers in the United States, and whatever they do, most of the private payers follow suit. So what we've seen in Idaho is that now that Idaho Medicaid recognizes pharmacists as providers, all the major payers have begun to recognize pharmacists as providers and pay them for their services without them having to dispense a product, which is something I was told in pharmacy school I would never see in my career, and I'm not that old. So I'm going to see it a lot before the time that I retire, hopefully. And I'm super hopeful that our students, when they graduate, that they're going to be able to do some amazing things and some really outside the box things that most people wouldn't think of a pharmacist doing. So that's my answer. Really long-winded, shocker. So sorry.
Oh, it's so exciting though. I mean, yes, it gives me chills. It's like Dr. Adam, yes, it's a little nerdy, but for really, really good reason, because ultimately, if you pay pharmacists for the care that they provide, the goal is that you're going to provide better care for your patients, because then at that point, pharmacists can be embedded in practices as a provider that can receive payment for the service that they do. Already pharmacists are already recognized as being of such high value that practices are currently still embedding them, even though this initiative that Dr. Adams is talking about is only just getting rolling. But when you include a pharmacist in a patient's care, you improve their outcomes. It's proven, it's out there, and it's just, it's so exciting. It's so exciting. So
Outcomes go up and costs go down.
yes,
Win-win situation.
all the way.
And it provides increased access, right?
Yes.
95% of Americans live within 5 miles of a pharmacy. Maybe not in Alaska, right? They're but 95% of the people in the United States live within 5 miles of a pharmacy. They might live 125 miles away from a physician's office, right? So access to care, if pharmacists can provide services that we're training our students to provide, like it's super exciting. So yeah, I kind of nerd out on it, but yeah, I'm super hopeful for the future, because I know you guys are going to be smarter than me, smarter than a lot of our faculty, right? And you're going to do some really cool, really innovative things with the opportunities that we're setting the stage for. Then you guys are going to come in and take it to the next level. And I'm just excited to see what happens over the next, 2/3 of my career, to see what you guys all will do. So I think Seth was going to ask a question.
I actually just had a comment. I think that's absolutely crazy, because for me right now, I'm a pre-pharmacy student, and I got vaccine certified this year back in like March. And when you were saying like in New York, you couldn't do shingle shots or like a flu shot to somebody over the age of 18, I was like, I've done shots to kids like 9, 10, 11 years old. So I think it's crazy, like the different legalities from state to state. And I don't know, I just think that's absolutely crazy.
And the PrEP Act is what allowed you to do that as a technician.
Mhm.
Alaska hadn't yet fully embraced allowing technicians to administer immunizations until COVID, right? I like to say the best prepared emergency ready pharmacist is one who's already practicing at the level we need them to in an emergency. So we need advanced scope of practice for pharmacists across all 50 states, because otherwise, can you imagine, like, if you had to learn all this stuff in the middle of a pandemic and you had to change all your workflows to make that stuff happen? Like, it makes it a million times more stressful. But if you are already there, which Alaska was almost already there, like just adding the technician piece was the kind of major key difference between Idaho and Alaska when it comes to that. So
Oh yeah, and then one more comment. Well, I guess question. So going back to like your like association management, seems like it's like a lot with like law, and then a lot with like student help and all that. So for like pre-pharmacy students like me who are interested in a position like that, what steps should I take now to better prepare myself when I get into pharmacy school?
So do everything you can to be ready, right? So shore up your educational foundation now, because you still have to get through pharmacy school and do well in your classes, right? You might not ever practice and take care of patients in the same way that most people think of in a career like association management. I did work part-time at Walgreens for about 10 years. So I did still, I felt like I needed the street cred, right? But technically in my day job, I didn't do anything that I took care of patients, right? But you still have to get the educational background that'll prepare you for that. So do well in school, focus on your studies first and foremost, but fit in those leadership opportunities. You took the first step, you're here, right? You came to the meeting tonight, and you're participating in the Prepharmacy Club. keep doing that when you're in pharmacy school. It'll be hard because your level of stress and pressure around academics, it's going to increase in pharmacy school, right? And you have to be able to find time to manage and balance being a student leader and being a student, right? So continuing that opportunity to find ways to lead, and to find ways, like we've got faculty that are working to change the world all over the place, right? We've got them in Alaska, we've got them on both campuses in Idaho. And if you partner with them on some of their projects, one of the things that we worked on, a group of faculty, some from Alaska and some from Idaho, we worked on an analysis of the Western states that have kind of more advanced practice for pharmacists. And we evaluated the stepwise process that they used to change the laws in their state to get paid as pharmacists, right? We also looked at how they would advance the scope of practice to provide like a sort of a primer for the states that are looking to do more. Like, where do we even start? Where do we even look in the law book? What do we need to change? What do we need to do? So the whole point of this research project was to provide them with this, here's the experience at these states. Here's what's good about what Oregon did, and here's what's not so great about what Oregon did. Here's what's good about what Idaho did, and here's what's not so great about what Idaho did. And we provided that in a research article. One of the people who did a huge amount of work on that was a PharmD student. Her name's Caitlin, and she worked really hard, helping us collect some of the data, helping us to analyze some of the data that we were pulling together from the different states. So there's a lot of opportunities like that, particularly at ISU, where we're looking at various different things across different state lines, right? Because we're Idaho and Alaska. So, so look for those opportunities. That happened because she asked a faculty member if she could help. Like, totally just put herself out there and said, hey, I heard about this project you guys are working on. I want to help. How can I help? And we found a way for her to help. So look for those opportunities. That's my advice. Lots of steps. Do well in school. Continue participating. Be a joiner. Join the groups. Be a student leader where you can. And then look for those potential opportunities of different projects that faculty are working on that you could potentially help with and help make a difference.
Perfect. Thank you so much.
Sure.
I'm just going to piggyback on that for a quick moment too, Seth, just and anybody else who might be interested in those opportunities. One wonderful thing that Idaho State University has is something called a career path internship, or CPI. And what that essentially is there are students that Idaho has funds set aside. I believe they're from a donor or a federal. I'm not sure if they're grant or donor, but regardless, they're funds set aside specifically to pay students a rate for work within your career path. And so every year we get a certain budget, the amount of money that we can hire CPI students to do work at the college. And those students are typically working with faculty on those projects, those initiatives like Dr. Adams is talking about. And anybody who is interested in those too, ask anybody, hey, who's the faculty who's doing, who's doing what? There's so many things happening. It's pretty exciting to be, it's a really exciting time to be a pharmacy student and a pharmacist.
For sure. And there's definitely those opportunities that are paid and some that are voluntary. Just depends on the project. And the project we were working on was a non-funded project. So there wasn't any research dollars, like any grants behind it. So our student worked with us on that project for free. But I have other projects that I've been working on that I do have some grant dollars to be able to pay students. So lots of opportunity there. For sure.
And also independent study as well. Sometimes students will get involved with projects for independent study credit, or, and in the case of Caitlin, so that was a published paper, right? So she's a published, author or involved in a study as a pharmacy student, which is a really cool thing to have on your CV when you graduate. Really cool. So.
Yeah. We were
Actually, I was going to put a plug in that I was a CPI student up until about a couple of months ago. And I worked on several projects with Dr. Ratliff, who's on the Alaska campus. And one of the projects I'm working on right now that we are looking to take to ASHP, which is a national pharmacy organization. So it would be like a student poster publication style thing. But I'm working on pre and post protocol for remdesivir. And for those of you who don't know, remdesivir is one of the major medications that are used to aid in those who are severely sick with COVID-19. And that project was through that CPI opportunity. And so there's just a plethora of opportunities at ISU. I'm a third-year pharmacy student. I don't know if I made that clear, but it has grown me as an individual. It has grown me as a student leader, kind of like Dr. Adams is talking about. And there's so many opportunities that you can take up as a student and that are worthwhile.
Yeah, just a quick, so everyone, this is Liv Swanger. So yes, as she mentioned, she is one of our third-year pharmacy students up in Anchorage, and also one of our lead student ambassador. So while if you have any student related questions as well, she's also available to answer. Well, so we have about 7 minutes left before we promised Dr. Adams that we would let her go free because I do know that her free time is finite. I don't think she sleeps, everyone. I really don't know where she finds the time to do everything. So
I'm gonna have an hour after this to unwind and watch television and then go to sleep because it's later here.
Yeah, that's true. That's true. The time zone difference. So if we have any last minute questions, now's the time to get them in.
What other classes do you teach?
So I teach Intro to Pharmacy Law to our first year students. It's just like a 3-hour series. Essentially enough that you know where to go to get your intern license, how to renew it, all that kind of stuff, and how to not break the law when you're an intern. So just the basics your first year. And then in the third year, in the spring semester, I teach a full 2-credit course on pharmacy law for both Idaho and Alaska. So I get the fun pleasure of learning the law for both states, which is good. I also teach in the legal issues course for our clinical psychopharmacology program. I teach in the leadership and advocacy elective, which is one of our elective courses. I'm a guest presenter as well in one of the ethics courses for our third-year students. I talk about some of the ethics of fertility from more of a patient experience. So lots of different things that I get to do. And I teach also in the student ambassador elective as well. We talk about diversity, equity, and inclusion in the student ambassador elective and how ambassadors and leaders have to understand diversity, equity, and inclusion to be good leaders. So lots of different things, none that you would think a typical faculty member would teach, right? You think they're teaching like pharmacology or any of those pharm sciences. Nope, that's not me. I'm more of a policy wonk and teaching in the more social and administrative sciences. I also offer independent study electives too for students that want to do research with me. I have a student doing research with me right now. We've done some analysis to look at what's the profile of someone who's the least likely to be vaccinated for COVID-19. It's a white Republican male with low education and low income. So we've been working on a couple different things related to that, and how would you target messages at those folks to try to encourage whether it's COVID vaccination or flu vaccination. So I'm doing some other stuff too around maternal immunizations and encouraging. We know that moms are the decision makers in the home. So Moms influence whether or not kids get vaccinated. So if we can get moms to be sure that they're up on their maternal vaccinations, so getting their Tdap and their flu shot at the appropriate time during their pregnancy, that they're more likely to make sure their kids are vaccinated as well. So yeah, the independent study student working with me on all that stuff.
I had a quick question. In your professional opinion, from what you've seen, what specialty do you see like the most need for right now?
It's probably the hardest job in pharmacy, but people that are willing to do advanced practice in the community pharmacy setting. That's the place where patients have the best access, right? So people that are willing to provide advanced services like diabetes care services, hypertension care services. I mean, think about it, it's a lot easier to go in, have everything done, get your labs drawn, do everything in the pharmacy, and then walk out with your monthly prescriptions. We see patients more than other healthcare providers do because they're often coming in every 30 to 90 days, right? So people who are willing to, and community pharmacy is hard. It's not easy. I did it part-time for 10 years. I was not always the fastest either because I was part-time. It wasn't right in the front of my brain. I had to pull it from the back, you know. It's not easy. And sometimes, I mean, patients are coming to you when they're sick. They don't feel well usually when they come in. But you have an opportunity to change, like you're the last stop in their healthcare day in a community pharmacy. You are the very last check before they go home. And you can make or break their experience with their disease, depending on how that interaction goes. So there's a ton of specialties. I mean, literally I have a friend who was a pediatric infectious disease pharmacist, right? Like worked with kids with HIV. So you can be as specialized as you want to be. But I think the area that our country and our two states of Idaho and Alaska have the biggest need is for people who want to do more in the community pharmacy setting.
Well, so if there's no other quick questions, we do need to let Dr. Adams go. Okay,
Well, I
so
very much enjoyed being here with you guys. I loved your questions and your comments. My email is jenadams@isu.edu, Jen with one N. So feel free to shoot me an email if you have other questions or things that you think about. And I'm always good for some career advice. So I've seen about all that there is when it comes to different career paths. So I'm happy to talk through pros and cons of any of them with you guys.
thank you so much, Dr. Adams, for joining us this evening, taking time out of your very busy day. It was a pleasure. And as always, you're incredibly inspirational. I am refreshed every time I hear you speak.
Oh, thank you.
Yes, thank you so much. I really appreciate it.
Absolutely.
Thank you, Dr. Adams.
You're
Thank you,
welcome.
Dr.
Good luck with everything. You guys are all going to get in and you're all going to be great.
Thank you.
You're
All
welcome.
right. Good night, everyone. Bye.
Bye.